Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plan. Our topic today is principles of periodontal treatment. Joining me today in the studio is Dr. Lee Sheldon and Dr. Matthew Sheldon of Solid Bite Dental Implants. I could start the show, Matthew, by apologizing to you for the fact that you're doing a show with your father. But I won't do that.
I'm glad to be here. Thanks for having me, Joe.
I couldn't resist because you're always on these television shows getting a good dig at me.
You're darn right, Joe, and it's going to continue today.
Okay, all right. But no, seriously, I think it's interesting when we talk about, we talk about professional people working together.
Yeah.
The fact that you told me a long time ago your son was going to be a dentist.
Right.
And I can imagine how much it means to you to have Matt working with you.
That's a real thrill. It's a real thrill to have him with me. You're right.
And you described to me a procedure that you all did recently where you were in surgery for roughly 12 hours and Matt helped you with the patient.
That's right.
We're going to talk about principles of periodontal treatment today, but quickly for our viewing audience, tell the people what the two of you did to one person yesterday in 12 hours.
Well, this patient had teeth that were diseased, and he tried several things to be able to keep those teeth, and they weren't able to be kept. He wasn't satisfied with his looks. He wasn't satisfied with his ability to chew. He just wasn't satisfied. And so yesterday, what we did was to extract all of the remaining teeth. We reshaped his bone because his bone actually wasn't in good shape to provide an aesthetic appearance to his prosthetic teeth, the new teeth that he's going to get. So anyway, we extracted the teeth, reshaped the bone, placed dental implants, and by the time he left on last night, he had a full set of teeth on the upper and the lower arch that he could chew with.
You actually had the new teeth in there?
Yes.
Okay, but how did you make the new teeth yesterday, or did you make those ahead of time?
They were made in advance. They were made, I work with a dental laboratory. They made those in advance, and then we fit them to the dental implants that
Okay,
day.
so you took an impression before of his current teeth, and then...
A lot of treatment planning's involved with that, so we see them a couple times before that visit, and by the end of that last night, he had teeth.
I mean, it's amazing.
Now, let me tell you a little secret, because the secret isn't known because we talk about this and, the TV ads and all the things that we do. It's teeth in one day or something like that. What people don't know is that these are temporary teeth. What do I mean by that? It means that we've extracted the teeth, we've put the dental implants in, and we've attached the teeth to the dental implants, but afterwards the gums shrink a little bit, so you can't do the final teeth. You have something that he can chew on, but for the next 3 to 6 months, while these implants are solidifying in the jaw, the gums are going to shrink a little bit, and then at that point, we can give him the permanent teeth. So we'll make impressions after the gums shrink, and then I'll have his permanent teeth at that time. So
you actually make two sets of teeth?
That's correct, yeah. So in advance, we have something that's a prototype for what we're going to, what's going to be there. They'll look good, they'll feel good, but they're made out of temporary materials. Okay. And then later on, the more expensive and the more extensive work is done.
But you put the expensive ones in me, though.
You always get the expensive ones, of course. But in your case, you notice we put the dental implants in, and those implants we allowed to solidify in the bone for a few months before we made the permanent teeth. We want to make sure the gums are in their final position before we actually make the final teeth. Otherwise, there's spaces and things like that they're difficult to get done with.
I agree. And you on these shows, you've mushed your face around all these things, but when I take my jaw and move my fingers on my jaw and move it back and forth, those implants feel just like my real teeth.
And that's the way it's supposed to be.
That's what it's supposed to be.
Yeah.
We're not talking about implants today. We're talking about periodontal treatment. So let's shift subjects.
Okay.
What is periodontal disease?
Well, let's look at what periodontal means. And perio, for those of us who are Latin scholars, means around. And dental is teeth. So it's the areas around the teeth. So what are we talking about? The teeth are embedded in bone. And between the bone and the tooth, there's a ligament. Just like we have a ligament that holds our arm to our forearm, we have a ligament that holds the teeth to the bone. So when we have periodontal disease, there's a deterioration of that ligament. It's deteriorated because of an infection around the tooth. And as that ligament deteriorates, the bone support is lost for the teeth. And the ultimate result, if we don't treat the periodontal disease, is the tooth gradually loosens because there's less and less bone support for the tooth, and the tooth comes out. So periodontal disease is that disease around the tooth that causes the tooth to loosen and come out.
Okay. Short of pulling a tooth and putting an implant in,
Yeah.
what can you do to treat periodontal disease?
Well, let's understand something, that when the body just doesn't loosen the tooth for no reason at all.
Right.
There's bacteria on the root surface that gets down below the gum line, and the body doesn't want to have anything to do with that tooth whatsoever. Doesn't want to have anything to do with an infection. You know, the body's trying to push the tooth out because the tooth is carrying infection into the body. And that's why it gradually melts the ligament away. So in terms of treatment, the treatment involves the thorough removal of the bacteria and the hardened bacteria, which is called calculus, to remove that from the root surface. So now the body wants to keep the tooth rather than reject it.
So in the case of people as they get older, the onset of periodontal disease can actually contribute to other diseases growing in the body.
Well, that's true. The fact that we have, by the way, there have been 11 different bacteria, Joe.
What now?
11 different bacteria that have been identified with periodontal disease. It isn't just plaque accumulates on the teeth around the gum line and you have loss of bone support. I mean, that's the general view. But really now we're very, very specific in identifying which of the bacteria are there, because some of those bacteria are really virulent. Some of those bacteria can cause significant disease in other parts of the body. We're talking about heart disease, we're talking about diabetes, we're talking about asthma, we're talking about Alzheimer's disease. There's been associations between these bacteria and all of those diseases. Matter of fact, as more and more research is being done between periodontal disease and other diseases in the body, the research is done, they say, oh yeah, there's an association with this one. Oh, there's an association with this one. So now we're seeing more and more, diabetes is a big one, we're seeing more and more links between the periodontal disease and other diseases in the body, but more links sometimes between very specific bacteria that are associated with periodontal disease and other parts of the body.
Matt, in terms of what your dad and I are talking about now, since he went to school to learn his dentistry quite a few years before you did. You are a graduate of the newer school of dentistry. What is your dad saying about periodontal disease that you've been picking up on as you graduated through a later school of dentistry?
Well, I feel I'm fortunate in where I am in dentistry today, the 21st century. It's beautiful. The technology is there. The principles have stayed the same over the years. Just the way to clean things up have changed dramatically. Things in our office, like a Perioscope, where it's a tiny little camera that can go below the gum line and find the disease that my dad was talking about. So we can see the disease, clean it up, and therefore reestablish that ligament that was lost earlier.
So what you're saying is that, well, one of the shows I did recently for our Focus on Senior television network was involved the field of robotics. And I had 4 surgeons from Wusthof Hospital on, who we talked about the use of robotics in surgery today. I sort of, after listening to what they had to say and my own research, the camera that you all have at Solid Bite Dental Implant, which is the only one that I'm familiar with in...
It's the only one in the county, and there's very few in the state.
Yeah, there's only roughly around 50 of them in the United States.
Yeah.
Yeah. But that little periscope camera that you have, it goes down below the gum line, is sort of, can do the same thing for the teeth that robotic surgery can actually do for the field of surgery.
Well, it's true. I mean, there are, technology is great, and there's some technological advances that, okay, they're there. And then there's some technological advances that really, really, really make a difference. Now, what are we famous for? We're famous for cutting gums. That's what periodontists do. They cut gums. Can you imagine having something that for most people eliminates periodontal surgery as part of the ordinary treatment for periodontal disease? I don't cut gums very much anymore. I do for dental implants, I do for bone grafts, but in terms of taking care of chronic disease, periodontal disease, I very seldom have to do surgery. Why? The reason we did surgery, and some of us still do surgery for periodontal disease, is because you can't see the bacteria on the root surface. So you have to peel the gum tissue back away from the tooth in order to be able to see that bacteria, that hardened bacteria on the root surface so you can get it out. Now, with the Perioscope, we have a camera which goes down into that area so we can see that bacteria. And I don't even have to do the treatment. I have a hygienist, Rebecca Caudill, who's been with me for 29 years. She's an expert in use of the Perioscope. So she can place the scope down below the gum line. She can see the calculus. She can get it out. No surgery. And because she's doing it rather than my doing it, or Matthew doing it, it costs less. So how can you beat that?
I'm finding as I do more of these television shows and get into specialized areas of dentistry, general medicine, surgery, that there are many things available to our viewing audience that they simply don't know that are available to them that can make their life a great deal easier. Matthew, you mentioned bone shrinkage, and you did too, Lee. I'm aware that you have a product now that can grow bone. Is it possible in treating periodontal disease, is it possible to use some of those kind of techniques to grow bone short of putting a dental implant in?
Yeah.
Can you talk about that?
Yeah. There's a couple things. Number one, the infection has to be gone before anything can occur, before any healing can occur. So the roots have to be totally clean. And by the way, when the roots are totally clean, we sometimes don't even, in fact, very often, we don't have to do any bone grafting. Why? The bone melted away because the bacteria is on the root surface. If we reverse that process, take the bacteria off the root surface, the bone sometimes grows back all by itself. Isn't that neat? So the bone will, the area will heal. And we've got lots of evidence on x-rays to show that. But let's assume that it doesn't. Why wouldn't it happen? Number one, maybe even with a perioscope, even with a fancy material, scope that we have, maybe we didn't see something. And so I have to do the surgery in order to be able to see that bacteria. But sometimes the body just doesn't want to regenerate the bone. So what do? Peel the gum tissue back away from the tooth. And I know that sounds gross, but okay. You peel the gum tissue back away from the tooth. And these days, we can harness the body's own growth factors to reestablish new bone. So what do we do prior to that? We take a little bit of blood out of the arm. We spin it down to centrifuge. We harvest the platelets. We take the growth factors out of the platelets, and they're growth factors that are in your platelets of your blood.
Right.
And we can concentrate that, put that down below the gum line, sometimes mixing it with some cadaver bone or some bone from the outside, which is a little powder. We'll mix it up with that and suture the gum tissue back into place, and that will encourage new bone growth around the tooth.
A question I have, and this is sort of an unfair question to ask a dentist, but you mentioned the word platelets.
Yeah.
what is the normal count for platelets in an average person?
It's a good question. I can't give it to you without looking it up myself. Thanks for embarrassing me, Joe.
I know. Do you know, Matthew? You don't know either. The reason I ask is because I know my platelets are low.
Yeah.
And I went to a hematologist, and he took me off certain medications, told me not to reduce my alcohol intake because overuse of alcohol, I wasn't doing it, but overuse of alcohol can tend to lessen your platelet count.
Well, that would make sense because when you drink alcohol, you don't clot very well. So that's true.
Okay.
Yeah.
So I think if anything is happening, and I think it's happening more in the field of dentistry that I'm aware of, because I talked to you about all this stuff, but there's so many new techniques coming out that make it not so necessary to do some of the things that we did to our mouth in the past. There's better ways to treat. What pick up on that, Matt?
Yeah, one of the things that we use in the office all the time that is very beneficial to the patient, less surgery, is if they need a dental implant.
Is what?
If the patient does need a dental implant, we can see it on computer software. We can virtually place the dental implant, make a surgical guide that fits where we place it on the computer, and the dental implant can go into that site with a lot less surgery time, a lot less cutting of the gums.
Okay. You know, my wife gets a lot of medical magazines, and she gets these nutrition magazines, and she gets all this stuff. She has me read this stuff about what different foods do, what spinach, what green vegetables can do. And I know you're sort of are you a health food addict like your dad?
Absolutely.
Oh, geez. Okay, but anyway, having said it, can both of you talk about the value of nutrition, and for those of us as we get older to recognize that we can change eating habits so that we can do a better job of enabling ourselves to prevent disease and also to heal?
Yeah, well, there's a few things that we understand. We've talked about this on previous shows. And that is that the body itself requires a certain number of nutrients in order to be able to function on a regular basis. And what's happened over a period of years, either through the change in the way we grow foods or in our own habitual changes, that we decide to go to the fast food place rather than actually cook our food or go to a place that cooks food properly, we've reduced the number of nutrients that have gone in the body. What happens as a result? And you've talked about it with physicians as well as talking about it with us, and that is that inflammation goes up. You know, what's inflammation? You get an injury to the body, you get inflammation to that area, so the right cells move into that area in order to cause healing. And that's acute inflammation. But what happens if you continually eat the wrong foods is your body is continually in a state of inflammation, of chronic inflammation. And when you have chronic inflammatory changes that are continuing because you've treated yourself poorly, you've eaten poorly, that in fact you'll start to get chronic degenerative disease. And whether we're talking about periodontal disease, we're talking about heart disease, we're talking about cancer, we're talking about asthma, any of these are chronic degenerative diseases. So if we eat correctly, if we have fresh foods, particularly fresh fruits and fresh vegetables, and certainly protein is important as well. If you have all of these things in their freshest fashion, then the level of inflammation in the body goes down, and the chronic degenerative disease level therefore goes down, and you feel better, and you heal better. And there are lots of stories of people who were eating junk food, and then they go to correct food, and they eat correctly. And we see it in our own office, and people feel better, and their doctor's reports are better.
I'm thinking in terms morally of a word very familiar to us as we age, and it's the word arthritis.
Sure.
And arthritis is an inflammation.
That's right.
And I guess the hard thing to drive home to a viewer of a television show is the fact that correct eating, stop smoking, watching the amount of food we put into our body so that our body doesn't have to overwork to digest that food, all these things are what I call building elements to promote the development of arthritis.
I agree.
If a person makes up their mind, and possibly, Matthew, this is talked about more in a more modern school of dentistry, what kind of time period, or is there any kind of an indication of how much time it will require if a person shifted from the old ways to a new way to try to improve their body response? Is that a fair question?
I feel like it's never too late. A lot of the times what we see in our office is patients who are nutritionally poor and we see their bodies in a constant inflammation state. We turn them around with nutrition and periodontal therapy and other therapies that they need, and they respond beautifully. They feel better. They feel like they should be more active, and it's really a proactive step. And I find it's never too late for that.
I can remember when I was a young man, doctors, our old country doctors, used to give a shot we used to call B12.
Yeah.
What the heck was B12, and why did B12 make a difference? You smile, Matthew. You must know what I'm talking about.
I've been hearing it my whole life because I grew up a vegetarian, and the first question is, how do you get your B12? How do you get your B12? I've been doing just fine without that swift B12 shot.
But he's young. I haven't.
But
So B12 is a vitamin.
it's a vitamin.
Yeah, and it's a vitamin that primarily comes from meat. And what happens is the body digests meat and digests protein. And B12 is within that protein and it's absorbed by the small intestine. But a lot of us can't absorb nutrients and don't absorb B12 very well through the small intestine, particularly as we get older. And so we need B12 shots in order to be able to supplement that, even if we are a bit of protein eaters or meat eaters as well. And so for those people who are deficient in B12, you give them B12 shot, or now more often than not, you can use a B12 supplement. It's a sublingual B12. In other words, it melts under the tongue and it's absorbed into the bloodstream under the tongue, that you can get the amount of B12 that you need without necessarily
So
having
they're
to get the
still
shot.
doing things like that.
Oh, they still are, sure. My doctor gives B12 shots.
Okay, when you go into a store,
Yeah.
and you see all these bottles of I want to say herbal medicines or alternative.
Yeah, well, there's herbal medicines, there's homeopathic medicines, there's nutritional medicines, or vitamins and minerals and that type of thing.
How does a person that doesn't understand what all this does to the body, how do they know about getting on some kind of a new program that will help them when we talk about periodontal disease? And what can we do smartly ourselves to lessen our chances of developing periodontal disease?
Well, let's talk about one. With regard to nutrition, it really depends upon the individual nutrients you need and the individual manufacturers. You need to have a manufacturer that's doing a good, incredible job. And there's something called the National Science Foundation. I think it's NSF. I think it's National Science Foundation. If you happen to see that label on the nutrient, chances are it's what it's supposed to be. You're also looking for USP, United States Pharmacopoeia. If you see that on the label, chances are it's what it's supposed to be. If you're really looking for help, either you go to somebody who's really, really knowledgeable, and there's some owners of health food stores who really, really know what's going on, or you find doctors who really know what's going on, and that isn't every MD. There are certain doctors who are really, really good at treating disease. There are other doctors that are really, really good at prevention, and you have to seek those people out because they'll know what nutrients you need and what manufacturers you should be going to in order to be able to get those nutrients.
We have become so specialized in the treatment of body disease
Yeah.
that we've certainly gotten away from the old country doctor that said, no, you shouldn't do that, you should do this. They have a tendency to say, well, I'll send you to somebody who will tell you what to do.
It's true, and that's a difference in relationships. It's also it's a difference in structure and how medicine is delivered in the United States. And you know, this is primarily a medical show, but let me tout dentistry for a second. You know, the relationship, doctor-patient relationship in dentistry really hasn't changed very much. You're still seeing the dentist, you're determining with the dentist what your level of treatment is going to be, and you're in control with that doctor. You're not looking at, all right, what does this health insurance plan pay for, and which kind of doctor can I go to, and what kind of a controlled list do we have? That's medicine. In dentistry, we have that a little bit, but not to the same degree as medicine. So there still is, I would say, a real firm and good doctor-patient relationship when it comes to dentistry. For the most part, you choose your own dentist. You decide which dentist is like you. You're not looking at a list, and you're paying the dentist. And frankly, I know we don't like to pay for anything, but frankly, if there is a payment relationship, you're actually looking at the value of what I provide before you decide whether it's worthwhile spending the money with me. That does make a difference. And so when you're doing that kind of shopping and looking for a dentist, and we talked about that, as a matter of fact, an article in Florida today. You know, establish a relationship with your provider, and it doesn't have to be a dentist, any healthcare provider. Look for that relationship first. Find somebody who knows you, you know that person, and you feel comfortable with the give and take. You find that, then you're going to do very well, whether it's in medicine or in dentistry.
An analogy, we can ignore the correct preparation of legal documents and neglect spending $400 or $500 or $600 or $700 and end up costing ourselves or our estate thousands of dollars to set something right that could have been taken care of very, very inexpensively. The same thing in dentistry.
It's true. It's true.
The very same thing.
It's true. I mean, you can ignore, you can neglect, or frankly, you can sometimes depend upon a diagnosis that may not be the best diagnosis, the best treatment for you. You know, I'm a specialist, all right. I treat periodontal disease. And yeah, I think that if you have periodontal disease, you can do all these procedures in the world. You can do root planing and it can be provided by anybody. But frankly, I think we do it better.
Yeah, I agree. Thank you both. And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at 321-473-7770. For more information on senior care and resources, visit our website at helpingseniorsof.brevard.com. Be sure to listen to Focus on Seniors on radio station WMEL AM 1300 every Thursday morning at 9 a.m. And you can also look in your Florida Today newspaper health section every Thursday morning for our Focus on Seniors column. I'm Joe Steckler, and I thank you for joining us today for Focus on Seniors.